Everybody, Tribe Nursing here. Welcome back to my channel. If you are new here, make sure to hit the like button and subscribe. I make nursing content related to nursing lectures, skill videos. I also provide study tips. I've been a nurse for approximately 8 months now. I started off on a floor that was mainly COVID. And it is not easy. Let me start there. I'm going to break down this video in a few different types of subsections. First being the younger population that I see on a daily basis. Second are the elderly population that I see on a daily basis. Third is treatment styles that's used to fight off COVID, patients who have COVID. The fourth subsection is that I'll be talking about is the trauma and PTSD as a nurse within the healthcare field who have to deal with COVID, being in the front line and what it's like. And the fifth subsection that I'll be talking about is moving forward and what to look forward to in the future. And with all that being said, let's get started. So let's start with the younger population. So with the younger population, I do see a lot of young patients where I work. The issue being is that with younger patients, they're more autonomous. They're more, they want to go out a lot more. Not all young patients are like that, but unfortunately, some just don't follow the guidelines that's recommended. And it's really hard to see younger patients, and they're young, from ranging from the ages of 18 to 35. It's really hard seeing those types of patients within a COVID unit because a lot of them are struggling on oxygen, and it's very difficult to see that from my own eyes because I'm a pretty young guy myself. I'm 28 years old, and just thinking about, man, that could be me on that bed. So that really, it's very frustrating to see something like that, and it's it becomes very difficult to deal with this type of population because I would say that a lot of them are trying to enjoy their life and really just go out to bars and go out to festivals and just live their life, and there's nothing wrong with that as long as they're following the rules, just trying to be, have a safe distance in between each other and wearing their mask and being vaccinated. That's another thing. Being vaccinated, it really does decrease the severity of COVID. With vaccines, you are able to get sick with COVID. Let's get that straight. And although it will decrease the severity of COVID symptoms, so it's like if you get the flu vaccine, for example. If you get the flu vaccine, you can still get a flu. You can still get the flu. Although with the flu vaccine, it just decreases the severity of the flu-like symptoms. It's really hard seeing these patients who are, in a hospital bed, as I mentioned earlier, because although they can heal a lot faster because they are younger, I have seen younger patients who are intubated and are having a very difficult time. Another thing that I would like to mention is that with the elderly population, which is the second section I'm talking about now, is that the more severe their comorbidities, it makes it a lot more severe. The issue being is that since they have comorbidities of, heart failure, they've had an MI in the past, they have, chronic kidney disease, they have AKI, whatever their previous medical history is, it really is that cherry on top. COVID is the cherry on top, and that's what really makes patients who have COVID who are elderly, they have a more difficult time getting back to their baseline. It's really difficult seeing any type of patient in the hospital, with COVID, because it's a brand new, it's very brand new to us. We don't really know that much about it. We have been dealing with this pandemic for over almost 2 years now, or a little bit longer, I believe. And it seems like it's like a never-ending nightmare that will not go away. The elderly patients, they have a more difficult time in comparison to the younger patients, because especially elderly patients who have COPD and bronchitis, it really drops their SpO2 stats significantly. Now, what is the treatment style that's typically treated for these patients? Ever since I've been working on a COVID unit, the go-to medication treatment style is typically they are prescribed with dexamethasone, which is a steroid. The reason why they are prescribed dexamethasone, also known as Decadron, it's to decrease the inflammation. A couple side effects from dexamethasone: with steroids, it could increase your blood sugar. Now, patients who are already hyperglycemic while taking dexamethasone and while being nearly septic with COVID, their blood sugars are extremely high. Now, what is the treatment style for that? So, while typically insulin is given, fast-acting insulin and long-acting insulin. Another treatment style is remdesivir. Remdesivir is an antiviral treatment that is given to COVID patients to actually fight off the viral load. The goal of it is to decrease the viral load that a patient, has. Patients who are struggling with their SpO2 stats, we typically start with room air. A patient comes in with room air, and then they are advanced to nasal cannula. Nasal cannula goes up to 6 liters, and it should not exceed more than 6 liters. Anything more than six liters on nasal cannula is inappropriate and a patient should be placed on a non-rebreather or a venti mask. Typically, I like to place the patient on a non-rebreather. I think it's more suitable for them. Non-rebreather patients who have a non-rebreather could go up to 15 liters. Now, what happens if they are maxed out on their non-rebreather? Well, what you can do is that you can place them on a nasal cannula, 6 liters, and 15 liters non-rebreather. So now they are on 21 liters of oxygen. So now they are going to dangerous territory because they are not breathing properly on their own. They are not able to perfuse their body by themselves. So now what if a patient needs more oxygen? Now this is when they go on high flow. High flow oxygen. What happens if a patient needs more oxygen on high flow? There are also, you can put the patient on a BiPAP, continuous BiPAP, but if you are like on a medical surgical floor, a continuous BiPAP won't work on there. Now they need higher level of care. This is either when they go down to step down or ICU. If the BiPAP isn't working continuously, they move on to intubation. Intubation is when they place a tubing into their through the trachea into their pulmonary passages in order to deliver oxygen directly into the lungs. Now this patient would need to be ventilated on a ventilator. So there are different, as you can tell, there are different types of oxygenation that a patient would require if they cannot maintain their own SpO2. I would say that a good SpO2 to maintain is above 93%. Every nurse is different. They like to maintain something different. Although I like to maintain a goal of 93%. I like to wean off the patient as well. Weaning off is a very important process. We don't want the patient maintaining, keep staying on oxygen, because the longer they're on oxygen in the hospital, the longer they're staying in the hospital. And a quick tip for you nursing students, the goal when a patient first arrives into a unit, the goal is to get them discharged as soon as possible at their healthiest baseline. What if they're coughing? What medications can you give? Typically, what I've seen on a daily setting is that Tessalon, also known as benzonatate, can be prescribed, PRN or scheduled. Also, I've seen Robitussin with codeine or Robitussin just with regular Mucinex can be prescribed for cough as well. Typically, fluids can be given. Lactated ringers, 0.9, can be administered through a peripheral IV, or it can be given through a central line. Typically, these patients who are on fluids, are typically dehydrated due to their severity of their comorbidities, along with their COVID symptoms. So now that we went through all of the treatment styles that can be given for a patient with COVID, it's important to talk about the trauma and PTSD that a COVID nurse goes through. Seeing patients who are declining within their overall baseline, from their baseline, it's very traumatic, and it's very scary to see things like this, within the healthcare field, within the healthcare setting. Seeing patients who are intubated and seeing patients who are on high flow oxygen struggling to breathe. It's a struggle seeing stuff like this on a daily basis. And, knowing that you wish you could have done more to help those patients, that's something that lingers in my mind when I leave work. And it makes you think, what could I have done more to help this patient? And I think that's where the PTSD comes in. And it's unfortunate to think about such things because, nursing by itself, it's a very difficult career path, although it is rewarding because, you get to help others who are less fortunate than you. But at the same time, it's important to use self-care methods because, after caring for patients who have COVID, you have to care for yourself, and it's important to maybe, speak to somebody if you are feeling down or depressed, after seeing such things. It's okay to normalize things. It's okay to normalize that. And I think it's important that I would mention this because it's very taboo to talk about, depression, and very taboo to talk about, just being sad from what you have seen as a registered nurse, or healthcare setting, just healthcare just in general. Think about the Vietnam War, or the war in Afghanistan, or just any war in general. The PTSD that soldiers came back with after fighting in battle. I'm not gonna say it's a very similar situation because they've seen people die. Healthcare workers see people die. Although this is a more of a battle of biological warfare in a way. Seeing patients die in front of your eyes, that's something that's very traumatic. Something that a human being shouldn't have to see. Although, if you are getting into the healthcare field, this is something that needs to be normalized, and you need to, as I mentioned, find self-care methods. Now, how do we move forward? What do we do to move on with our life? How do we go back to normalization? Well, I believe that COVID is going to be sticking around for a while, and it's not going to be going away. It's going to be, it's going to be as common as the flu. So I think it's important to get that straight. Trying to figure out how can we eliminate COVID. I don't think it's going to go anywhere anytime soon. I think it's going to be part of our normal life. What we can do as healthcare workers, as nursing students who are going into healthcare, educating others about maintaining a safe distance, 6 feet apart, wearing a mask in public, and becoming vaccinated. I believe with the whole vaccination process, it's going to be, you will be having to receive boosters every however so often. That's going to be a normalization. Going back to a normal life probably won't be the same. I'm not trying to be a negative Debbie Downer, although it's very, from my standpoint, it's very unlikely. We'll be seeing COVID patients for a very long time, and that is something that no one will say. And I am here to tell you that COVID is not going away, in my opinion, and will be here for a long time. Viruses, they will mutate. A virus, the goal of a virus is they want to survive. So how do they survive? Well, from like an evolutionary process, they will mutate. This is why we see, new strains coming out. Now we see the Delta strain. Now we see all these different strains that's coming out, is because they're trying to mutate. These viruses are trying to mutate to survive. Now, this is why I say that it's not going to be going away. This is why we get a flu vaccine every year, is because the virus mutates every year, in order to survive. This is a common concept that's understood within healthcare. Understanding common biology of how viruses mutate in order to survive. Bacteria can live on surfaces for a very long time because they don't need a host to survive. As far as normalizing a normal life, you just need to make the best of it. Make the best of your life. I'm trying to leave on a positive note. Just live your life. Live your life to the fullest. Although, be safe. Be safe out there. It is very difficult. It's a very difficult time. Be caring to others. Help others who are in need. That's a very important concept, because all we have is each other in this world, and that's about it. So I'll go ahead and leave it on that note. Thank you all for watching. This is Tribe Nursing. If you haven't liked and subscribed, make sure to do so. I post videos weekly, and so make sure to look out for my other videos. Thank you for watching, and have a good night.